Hello everyone, and welcome to this audio podcast today. This audio podcast as part of the Equipoise. This audio podcast as part of a Labstorm Motley. This audio podcast as part of a Storm and Scuttle and Turbulence. This audio podcast as part of the Squakish Series or edition, and this audio podcast as part of a Storm Lobostics production. Through this audio podcast, a look at renal and infections. The audio podcast is sort of a generic overview in around in around sort of the in around some of the sort of infections that can be sort of can be sort of quite sort of serious around where renal pathophysiology is concerned. So to begin with, look at hepatitis C. Hepatitis C, a virus or HCV infection in CKD. So CKD patients or CKD recipients have a higher risk, a high prevalence of HCV infection compared with the general population. HCV infected CKD recipients with accelerated rate of renal insufficiency can have increased risk of developing ESRD, end-stage renal disease. Infection with HCV has been implicated as being sort of a causative in most recipients with mixed cryoglobulinemia or sort of where where there is sort of an effect in around the histological where there can be sort of several histological forms of glomerular aligned to several histological forms of glomerular injury. Additionally, HCV in recipients with ESRD has exceeded that of the general population, and transmission of virus have been evidenced in for example KRT recipients or RRT recipients. The risk of transmission is an ongoing hazard, or has been an ongoing hazard in as part of documented literature, and increased number of where an increased number of acute HCV infection events among recipients undergoing maintenance forms of KRT or RRT has all where maintenance forms of RRT or KRT where literature has also informed. Additionally, in regard to prevention or around HCV, have been precautions identified at dialysis clinics sort of historically, emphasizing the need for continuously improving infection control practices and environmental disinfection procedures, accompanied by adherence of Centers for Disease Control and Prevention, or the CDC. Excuse me. In as part HCV and ESRD recipients, specifically, investigations have shown that HCV infection is associated with an increased mortality in recipients with ESRD. Transplanting an anti-HCV positive recipient can be accompanied by a significantly decreased risk of death compared with those remaining on the waiting list. HCV infected renal recipients have an increased hazard ratio of death, and transplantation continues to offer recipients a significantly improved prognosis compared with those remaining on forms of RRT or KRT. In as part of HCV in solid organ transplanted recipients specifically. HCV is a systemic a systemic sort of condition with important extrahepatic consequences. HCV infection is a primary cause of, or can be a primary cause of hepatic disease in SOT, solid organ transplanted recipients. HCV infected recipients are at risk, can be at increased risk of recurrent membranous nephropathy and transplant glomerulopathy. In as part of now looking at methicillin resistant Staphylococcus aureus or MRSA. MRSA is a sort of bloodstream infection, which has been a major concern in healthcare systems due to its high incidence rates. The vascular catheter in place for some RRT recipients can be a frequent source of MRSA and bloodstream infection can be a frequent source of MRSA and bloodstream infection, and hemodialysis or KRT or RT recipients, especially those who dialyze through a venous catheter, are at particular high risk for this particular infection. As part of MRSA. Additionally, KRT recipients with MRSA infection have longer hospitalizations with higher costs. Patients or recipients with MRSA infections often receive antibiotic pharmacotherapeutics with glycopeptides glycopeptides. MRSA bacteremia has been defined as the presence of at least one positive blood culture for MRSA in a patient with clinical signs and symptoms of sepsis. Vascular catheter related bacteremia is diagnosed using clinical and microbiological investigations or criteria. And as part of sort of CKD infections more generically, high rates of infections in recipients with who undergo KRT or RRT can be attributed to infections owing to, for example, KRT or RRT vascular access, white blood cell and complement dysfunction, dysfunction in around the where the immune system is concerned, and contact with dialysis. And contact with dialysis membranes, that being the sort of compartment where blood is sort of recycled on dialysis machines, which are referred to as dialysis membranes. Ion overload exposure to bacteria and pyrogens are from contaminated dialysis water systems or inadequately cleaned dialysis machines are also can also be sort of issues. In around sort of additional risk factors of infection. So risk factors for infections not related to KRT or RRT excuse me, could apply at all stages of pre RRT or KRT, including the causes and treatment of renal abnormalities, comorbidities, and reduced vaccine effectiveness, and high levels high excuse me, and high levels of exposure to healthcare facilities. And as part of peritoneal dialysis or PED and infections, despite the progress and newer technologies and antimicrobial therapies, PD related infections remain common and sort of serious complications. Specifically in around a microorganism Clostridiales, difficile infection in CKD recipients. Patients in CKD tend to be high risk for Clostridiales, Clostridials, a difficile infection, which is the most one of the most common causes of transmissible nosocomial infections in healthcare, in amongst healthcare facilities, in amongst healthcare facilities, and then in around sort of the in around looking at multi drug resistant organisms. RRT recipients can be affected by the deluge of multi pharmacotherapeutic resistant organisms that have emerged as important causes of healthcare associated infections. Excuse me. And in regard to in regard to in regard to sort of a look at sort of preventing or precluding infections, following standard operating procedures and best practices can be useful for most in most and in a majority of environs in line to different recipients and around different recipients. Improvements in antimicrobial antimicrobial treatments and prescriptions where applicable is and can be important. Rigorous implementation of standard infection control measures or procedures for hygiene and aseptic handling of in around vascular access in KRT or RRT recipients is additionally pivotal. That draws this audio podcast to a close. This audio podcast as part of the Equipoise. This audio podcast as part of the Lab Storm Motley. This audio podcast as part of the Storm and Scuttle and Turbulence. This audio podcast as part of the Squakish series or edition, and this audio podcast as part of a Storm Lobostics production.